Gentlemen, let's be real. Have you ever wondered how guys in adult films look so massive? Or why does your urine sometimes spray in two directions? Or maybe you've lost your erection the moment you start overthinking during intimacy. If you've asked any of these questions, you're not alone. These are three of the most common concerns men whisper about but rarely feel comfortable discussing with a doctor. Today, we're breaking the silence. I'm Dr. Lila Romano, a board-certified urologist with over a decade of experience helping men reclaim their confidence and vitality. In this video, I'll walk you through why performance anxiety sabotages erections and how to break that cycle, the truth behind porn star size and the actual medical tricks performers use, and why urine sometimes splits and what it means for your prostate health. Stay until the end because I'll share a step-by-step action plan with daily habits and science-backed options that can transform your confidence. Before we dive in, hit that like button and comment below where you're watching from. Now let's get started. Most men believe if you lose an erection, something is permanently wrong. That's not true. Many men struggling with erections, especially younger men, aren't dealing with a physical problem at all. It's psychological. It's called psychogenic erectile dysfunction. Here's how it develops. The first time your erection falters, it surprises you. The second time, you anticipate it. By the third time, you're so nervous about staying hard that your body shifts into fight or flight mode. When you're in survival mode, your body prioritizes blood flow to your muscles and brain, not your genitals. Your nervous system is telling your penis, this isn't a safe time for intimacy. The erection fades. This isn't a weakness or a permanent flaw. It's your brain overriding your body. And this cycle can be broken. As a urologist, I see this constantly. Men come in terrified that one bad night means their sex life is over. But research shows about 87% of erectile dysfunction cases in younger men are linked to either psychological causes or early warning signs of cardiovascular issues. The penis has some of the smallest arteries in your body, so changes there often appear before problems show up in the heart. This means two things. If you're under 40 with regular issues, check with your doctor because your body may be sending an early warning signal. If your heart and hormones check out, it's likely performance anxiety, and that's fixable. Getting stuck in your head during intimacy. You want to perform, you want to please your partner, but the more you think about it, the less your body cooperates. Here's the biology. Erections depend on the parasympathetic nervous system, your rest and digest mode. Anxiety flips you into the sympathetic nervous system, fight or flight mode. These two systems can't dominate simultaneously. If anxiety wins, arousal loses. Emotionally, this feels devastating. Men start avoiding intimacy, making excuses, feeling like they've lost their masculinity. But here's the truth I need you to hear. This pattern can be completely reversed. Let me give you the three-step protocol I use with my patients. Step 1, remove the pressure. If you're in a relationship, take penetration off the table for 2 to 3 weeks. Focus on touch, kissing, and intimacy without performance expectations. As confidence rebuilds, gradually reintroduce stimulation. Step 2, consider medical support. A short-term prescription of low-dose tadalafil can help. These medications don't create desire, but they support blood flow so your body can respond. When you're naturally aroused, think of it as training wheels while you retrain your mind and body. Step 3, professional help. A therapist specializing in sexual performance anxiety can break mental patterns quickly. This is practical, solution-focused work that produces results. I had a 32-year-old patient who avoided dating for 2 years after 3 difficult experiences. We used pressure removal and low-dose tadalafil. Within 6 weeks, his confidence completely rebuilt. He's now in a healthy relationship and no longer needs medication. Remember, intimacy is about connection, not performance. When you shift focus from "am I hard enough" to "am I present," everything changes. Now let's be honest. Most men have compared themselves to what they see in adult films and wondered, why don't I look like that? Here's reality. Adult films are business, not biology. The average erect penis globally is 5.4 inches. Roughly 99% of men fall between 4.3 and 7.2 inches. So why do performers look so huge? Let me break down the 6 specific methods that are actually used in that industry. Method 1. Selection bias. Only men with above average size are cast. It's like only casting 7-foot athletes for basketball movies. Method 2. Camera tricks. Angles, lighting, and wide-angle lenses exaggerate appearance dramatically. What looks like 9 inches might actually be 6, just filmed strategically. Method 3. Vacuum pumps. Medical-grade pumps temporarily increase engorgement before filming. This adds visible fullness for 30 to 60 minutes, but isn't permanent. Method 4. Dermal fillers. Some performers get hyaluronic acid injections in the shaft for temporary girth. These last 6 to 12 months. It's a medical procedure with real risks, done purely for visual effect. Method 5. Medications. Sildenafil or tadalafil are commonly used before shoots to ensure firmness and stamina for multiple takes over hours. This isn't about size, it's about consistent performance for production demands. Method 6. Penile implants. Rarely, performers have prosthetic implants for severe erectile dysfunction. These allow manual control of when and how long they have an erection. It's mechanical control for performance, not size enhancement. Biologically, your size has little to do with satisfying a partner. What matters? Blood flow, confidence, and attentiveness. In my decade of practice, I've never had a partner complain about their man's size. But I've heard complaints about rushing, inattentiveness, and lack of connection. Comparing yourself to these images chips away at self-esteem. It's like comparing your Sunday jog to Olympic sprinters. Not the same playing field. Stop using adult entertainment as your measuring stick. It's curated, edited, and enhanced, not real intimacy. Now, let's address the third concern that brings men into my office regularly. A split or spraying. Urine stream. Gentlemen, if you've ever stood at the toilet and watched your stream suddenly split into 2 directions, hitting the wall, the floor, maybe even your own socks, you know exactly how frustrating and embarrassing this can be. But it's also worth understanding what's actually happening and when you should be concerned. Think of your urethra like a hose. If the opening is clean and unobstructed, flow is straight. Any partial blockage disrupts the stream. The most common cause? Residual semen. After ejaculation, small amounts can remain in the urethra, creating temporary blockage. This causes splitting for the next 1 or 2 urinations. Completely normal, resolves within hours. But there are 2 more concerning causes that you should be aware of. The first is benign prostatic hyperplasia, or BPH, non-cancerous prostate enlargement that presses against the urethra and constricts it. This changes the urethral opening shape and causes splitting. Spraying or weak flow. Very common after 50 and very treatable. The second potential cause is a urethral stricture. This is scarring or narrowing inside the urethral tube itself, often caused by previous infection, injury, or inflammation. This is less common than BPH, but does require medical evaluation and treatment. Now, here are the warning signs that suggest you should see a urologist rather than just waiting for things to improve on their own. If you notice a consistently weak urine flow, difficulty starting urination or hesitancy, dribbling after you finish urinating, frequent nighttime urination, waking up 3 or more times per night, or stopping and starting multiple times midstream. These are signs that something beyond temporary residue is affecting your urinary function. What you can do now: try sitting to urinate, especially first thing in the morning. In many European countries, this is normal for men and makes the process more comfortable as you age. Stay hydrated throughout the day. Make sure you're fully emptying your bladder each time. If symptoms persist over a week, your flow continues weakening, you have pain or burning, or you see blood in urine, see a urologist. These indicate BPH, infection, or other conditions with effective treatments, but they need professional evaluation. For science-backed prostate support, I recommend a daily supplement with saw palmetto, which reduces DHT and supports urinary flow, pygeum for anti-inflammatory effects on prostate tissue, green tea extract as a potent antioxidant, and nettle root, which improves urinary symptoms in clinical studies. These are proven support tools working alongside healthy habits. Don't forget the foundation: regular physical activity. 30 to 40 minutes of moderate exercise, 4 to 5 times weekly, improves circulation, reduces stress, balances hormones, and supports cardiovascular function. What strengthens your heart strengthens your erections. Your realistic timelines for psychogenic ED with consistent pressure removal and possible medication. Most men see significant improvement within 4 to 8 weeks. For prostate support with supplements and lifestyle changes, expect initial improvements in 2 to 3 weeks. For rebuilding overall confidence, give yourself 2 to 3 months of consistent practice. Let me tell you something important. If you've struggled with erections, worried about your size, or felt embarrassed by urinary changes, you are not broken. You are not less of a man. Every one of these concerns is common. They're not signs of weakness, but signs your body is asking for care and understanding. Age is not the end of vitality. Small, consistent changes, checking your health, improving circulation, breaking anxiety cycles, supporting your prostate can bring back comfort, freedom, and confidence. Your body is adaptable. Your mind is resilient. And your masculinity is not measured by inches, by streams, or by performance. It's measured by your willingness to care for yourself and connect authentically. Here's my challenge. Leave a comment telling me one healthy habit you're starting this week to support your body and confidence. And if this video helped you, hit that like button. Subscribe for more science-backed men's health advice. Share this with someone who needs to hear it. I am Dr. Lila Romano, and I will see you in the next video.